viewing or listening to this podcast confirms acceptance of the disclaimer visible on your screen or found at authorscott.com/podcast. Welcome to the Regaining Health and Humanity podcast. I'm Dr. Scott Johnson, your guide on this journey to natural well-being. Here we explore evidence-based insights, revolutionary breakthroughs, and powerful health strategies that not only inform, but inspire change. Together, we'll uncover the mysteries of human existence and unlock the secrets to thriving. This podcast is more than just knowledge. It's your catalyst for unleashing extraordinary potential. Get ready. Your journey to boundless health and happiness starts now. Welcome to Regaining Health and Humanity, where we uncover the truths that help us live more naturally, intentionally, and vibrantly. I'm your host, Dr. Scott Johnson, and today we're diving into a hidden force all around us, electromagnetic fields, or EMFs. These invisible waves power our modern world, but could they also be quietly undermining our health? Joining me is Dr. Beverly Jensen, a leading researcher and advocate for safer technology. Together, we'll explore how EMFs impact the body and mind, why children may be especially at risk, and simple ways to protect yourself naturally. Dr. Jensen is a health champion and lifelong practitioner of natural medicine. She's an international speaker and certified health coach who has worked and lived abroad for years, learning how people around the world practice wellness. She's the founder of womensmedicinebull.com, which empowers women who make the majority of family health decisions to take responsibility for their health. Since 2019, Dr. Jensen's work has focused intensely on the health impacts of electromagnetic radiation from wireless technologies, especially on children. Her message at youandemf.com is aimed at parents, stressing that while we can't control corporate or government actions, we can take many practical steps right now to protect our families and reduce our exposure to man-made radiation in our homes, workplaces, and communities. Welcome, Dr. Jensen.
Thank you. Very nice to be here.
This is an interesting topic because it's an invisible threat that people just can't see, but in the modern world is ubiquitous. We're exposed to it all over because we have so much technology that emits radiation as part of the technology. I wanted to start out, Dr. Jensen, asking if you can explain what exactly are EMFs and why are they becoming such a growing concern in modern life?
The F can stand for fields or frequencies. So electromagnetic frequencies, what are they?
Yeah.
It's a pollutant we can't see, smell, or hear. So it makes it very difficult for us to recognize that we're being impacted or how we are being affected by it. And it is, as you mentioned, it is the children who are the most vulnerable because they've got very thin skulls and their brain and their nervous systems are just developing. So they're most susceptible to it. But it's becoming an increasing problem. This problem really only started 15 years ago. And if you look at a map of the United States for the last 20 years, a map of how the cell towers have been, we are now just blanketed with it. And over these 20 years, the frequencies of the power at which they're emitting, it has increased. Started out at 2.4, and even at 2.4 gigahertz, it impacts the human body. But now pretty much standard is 4 gigahertz. And now, of course, we're being exposed to 5 gigahertz. Yeah, and that's a range. It's not a finite, definite measure.
Yeah, so we want the better coverage for our mobile phones, right? And better reliability. And with that, there's a cost to it. And so we are now being exposed to this on a regular basis and at higher power, like you're stating. So what does the current research tell us about what these EMFs are doing and how they affect the human body at the cellular level.
You ask about current research, but we're talking about physics, and it
Right.
hasn't changed.
Mm-hmm.
From what was the situation now or when the research started by the Soviets in the 1960s. The only difference is we're now exposed to far more of it. The amount of the radiation has increased due to the proliferation of cell towers. So, interestingly, the Soviets did 800 studies between 1960 and the early 90s.
Mm-hmm.
They were tracking the health of their workers in workplaces that had low levels, an extremely low level, ELF, of radiation, to find out how long they stayed in a place, 1 or 2 years, and when they left, were they able to recover? And how long did it take them to recover, and what was the conditions where they went? Anyway, the Soviets have done extensive studies on this, and it's just as relevant today in 2025 as it was in 1960 and 70 and 80. Interestingly, the Soviets are not allowing 5G to be
Mm.
used in the public domain. They're going to keep it for military use. Um, and and how is this affecting us? It's affecting brain health
Right.
of everyone, and particularly in the development of children. And those impacts actually start in utero. So a woman should not be using a cell phone when she's pregnant, especially in the last trimester. There's been a lot of research done on this at Kaiser Permanente and finding out what was the effect on the fetus by the radiation. So it affects in utero, and then the first weeks after birth are among the most vulnerable times. And I went to a party a few years ago, which a newborn was sort of being introduced to friends, and everybody's excited, and they've got out their cell phones and they're taking pictures. Like there's 30 people around this newborn snapping pictures. This is before anybody was talking about the radiation effects. I wanted to I wanted to scream, step back, don't hurt the child. And interestingly, you can take photographs and look at photographs in airplane mode, which would reduce the radiation exposure 95%. But we haven't been told this.
Mm-hmm.
It's not widely known. So anyway, the child was probably okay, but it was nerve-wracking to watch. This hasn't become a subject yet that is out in the public discussion, and that's what I'm trying to do by reaching out to mothers and grandmothers to let them know that the children have got to be protected, you know, and then as do those actions, take those actions to protect the children, we'll be reducing our own exposure,
Right.
and everybody wins.
So, for many people, they might report some fatigue, headaches, and even sleep issues when
Yeah.
they are spending significant time around electronic devices, whether it's their cell phone next to the nightstand or the Wi-Fi router or whatever it is. Could the EMFs be to blame for this?
Absolutely. Totally. I mean, I've seen children whose baby monitor was right close to their bed,
Mhm.
and the child became autistic. Another child at age 3 was given a mobile phone so she could call daddy, who lived overseas, and she had leukemia by the time she was 4.
Mhm.
This is a very, very powerful and risky thing that we are dealing with. And it's, and the technology is, I don't know how we'd live without it, but we just need to live more safely with it, to be aware of the risk, and then take the actions and change some of our behaviors.
You mentioned earlier that the brain is vulnerable to EMFs. And so that
Mhm.
leads me to my next question, which is are EMFs affecting our mental well being or our emotional well being, particularly in relation to anxiety, focus, and just mood in general?
Well, for adults, anxiety and depression has become very common, and it's related to too much exposure to the technology. For young children, the American Pediatric Association recommends that children under 2 have no screen time, and between 3 and 5, no more than an hour a day, and to have the adult with them to sort of go along on the story that they're watching. They're not saying that when you're doing this with a child, that it should be on Ethernet cord. That just dramatically reduces the radiation. But it is a way to watch a cartoon or a favorite program and keep it much safer by having the device wired or downloaded, watching it when it's downloaded. That will reduce the exposure. But otherwise, the frequencies are affecting this area of the baby's brain that is where intelligence develops and language. And this has been shown in several studies. And then as they're getting older, the mental health is affected by not being able to, as more activities of control of emotions and just getting very angry when it's really not necessary or called for, outbursts, breakdowns, and fury, all of which, there was a story this week at Epoch Health, Epoch Times, and talking about the mental health problems. One boy was he'd been at the top of his class and started, if he didn't win whatever he was doing, he would just have a meltdown and was beginning to cause serious social disruption in the classroom and for the child. The parents took him to a psychologist whose prescription was to cut him off from all screens, television, phone, iPad, nothing for weeks. And they did that, and the boy completely recovered. 6 months later, he's running for class president. So, it has a dramatic impact on our mental health. There was a study in Denmark. Scientists uh, tracked 13,000 pregnant women. So this is a huge study. Half of the women used cell phones when they were pregnant, and half of them did not. This is 2005, I believe. This study was done in Denmark, but in that area of the world, heavy use of phones very early, and so 7 years later, the researchers go back to meet the children who were born to these 13,000 women, and the differences in the mental health, social and in emotional well-being between the mothers who used cell phones and those who did not was dramatic, between 25 and 49% difference. So, I mean, there's lots of factors when you're talking about a longitudinal study like that.
Right.
But the differences in measuring the well-being of the children was quite significant, dramatic.
It's remarkable that such a simple thing as a cell phone use, something that most of us do on a daily basis and don't think anything of it, could have such a dramatic impact on the offspring. That's significant, and in my opinion, more people should be made aware of that so that they know the risk and they're informed and they're not just using it thinking there's no risk at all to their developing child.
Yeah.
We know that children are more susceptible to most things, and as you mentioned earlier, EMFs is one of them. Can EMF exposure affect a child's developmental or hormone systems, even up through adolescence and even as teens?
Yes. I mean, the amount of research that's been done, particularly on the teenagers and what's the consequences to them, it seems to affect the girls more than the boys. These feelings of loneliness and isolation. It's like you can have 500 friends on Facebook, but you've got nobody to talk to.
Yeah. No real connection.
No real connections, no real friends. And that's because you've spent all your time there. And your friends are doing the same thing. So I think that parents need to, and parents are beginning to realize that they have got to intercept this, make some changes, start to put some limits and boundaries on where and when and how long children can be using these devices because they are not healthy for them. There's been some very positive developments in that area the last few months. Two moms in the UK started on Instagram. Of course, the irony of all of this is that we're telling you to get off of this, and that's exactly where
Hmm.
we have to find you.
Yeah.
So anyway, these two moms created a group to the effect of Save Childhood. I think in 2 months, they had 60,000 moms join in because when the child is playing with this device and they're not even talking about the effects of the radiation, but just looking at the social aspects of it, they're not spending time outdoors playing, getting any exercise, learning how to be social. And so another group that formed like this was Wait Until 8th. It's a Facebook group. The last I heard, they had 100,000 members and parents who recognize that the children are harmed by these devices. And I think they gain strength and power by working together. And I think they probably need to be reaching out to the parents of their children's best friends. You know,
Mm.
that's where it is. That's where you get the real impact. But these are good developments. I think the first thing we need to recognize is that we're all electric beings. I
Right.
mean, everything in our body is directed by electric impulses from heart and brain.
Hmm.
And second main point is that if any device, every device that sends radio signals and receives radio signals is emitting radiation, which I think somehow we all know that radiation is harmful, but those 2 points have sort of been glossed over, ignored, and even in the schools fortunately, they're starting to intercept children bringing the phones into the classroom. I think I've been following this news for a year or two now, and they're talking about how it disrupts learning in the classroom and
Mm.
how it affects the social aspects of development of the teenage years when they're spending so much time on their phones. Nobody is actually talking about, actually, I think Secretary Kennedy mentioned it in an interview, the radiation coming from those phones.
Hmm.
It hasn't even been on the table, a subject on the table. So you can bring the phones into the school and turn them off and put them into your backpack. But if it's an iPhone, it continues to contact the cell tower, whether it's off or not. And I think more than half of the phones are iPhones.
Yeah.
This is an improvement, but it's ignoring, not recognizing the fault of radiation, even when they're in the backpacks. They need to be in a little Faraday bag, or they need to
Mm.
be collected someplace else in a bigger Faraday cage.
We've mentioned some of the most common sources, your mobile phones,
Yeah.
cell phone towers, Wi-Fi, those kind of things. But what are some maybe sources of EMF exposure that are in our homes and workplaces that people often overlook?
I don't think that the majority of people have any idea of this. And every house I've gone into, the router has been sitting right there in the middle of the living room, usually next to the television. And it is the biggest source of the radiation. And it's very simple to manage. I mean, first of all, it shouldn't be kept in the living room. It should be put into the least used room in the house, which most certainly can't be a bedroom. And then it can be shielded with material. My favorite is using aluminum screening from the hardware store and just wrapping that around it 2 or 3 times and stapling it together. Costs $10, takes you about 15 minutes, and that reduces the radiation from that router by 97%.
Hmm.
And another one is to, even with it shielded like that, to put a timer on it so that it shuts off when you go to bed. When the household is going to bed, it goes off automatically. So that's the foremost thing that people should be doing, is getting the router out of the living room and shielding it and turning it off. And I think probably the next most frequent thing is to have some, and this requires a family conference, have some rules of the house as to phones. They are, my daughter, who's got 3 kids and all under 10, they have what they call it, the communications center. When they come home, the children have no screens yet, but the parents put the phones into the communications center so that nobody's walking around the house with the phone on. But another simple thing to do is, and I've measured this a few times, if you're in the house and your phone is connected to the Wi-Fi, you can put the phone onto airplane mode and you'll get your phone calls and texts. You can test this. You probably won't get data, but you're probably not walking around the house if you're somehow downloading data. But you can get phone calls and text messages, take pictures if you need to, on airplane mode. And by having it on airplane mode, but it's still connected to Wi-Fi in the house or in your office, you will reduce your radiation levels by 90 to 97%. It's a phenomenal little trick, that's easily done. And yeah, that's another great way to just reduce this.
From your perspective, what role do natural solutions like essential oils play in supporting the body's resilience to EMFs?
Well, it's interesting that the majority of your audience are female,
Hmm.
because it is women who are more susceptible to this. Women are more likely to be susceptible to multiple chemical sensitivities. I think that's often a precursor to electromagnetic sensitivity. I know that was true for me.
Uh, for them.
The uh, the best way of protecting yourself is distance and
Hmm.
time. Keep your distance from the machines as much as you can, and spend less time on them. And then earthing or grounding is
Hmm.
very helpful. When I have had a international flight, I will spend hours out on the grass after such a flight, weather depending and location depending. But time and distance are the first protections. I find flying and airplanes and airports the worst locations for me to be, as one who's sensitive to this. And so before I go on a flight, I will douse myself with a spray of oil of rosemary. And I
Mm.
do believe that helps. And the other things that I'm doing are that are natural, but not easily. Shielding is one thing. Wearing cloths that block the radiation is very important. Yeah, I think that those are the main points.
If there's one key takeaway that you would really want listeners to leave this podcast and say, this is the most important thing for me to do to protect myself and my family from EMFs, what would that be?
Remove the router from the living room, and then for your protection and the protection of everybody around you, keep the phone on airplane mode as much as you can. Yeah, those are two simple things that can be easily done and should be done.
Well, I appreciate you, Dr. Jensen, for bringing more awareness to EMFs and the risks that they have and the sources of exposure that are just prevalent in modern society. I
Yeah,
think that's one of the biggest things is we need more people to be aware of EMFs because
yeah.
if you're not aware, you can't take any steps to start protecting yourself or your family. So I appreciate that you're building the awareness, but also provide some tips about shielding, distance, moving maybe your routers to different places.
Yeah.
and that can be helpful so that people can protect themselves and their loved ones.
Thank you for talking about this, because it's only by more communication between us, and if your listeners talk to their families about it and their friends, this is how we can change things. Yeah.
Absolutely.
Thank you.
You bet. Thanks for being on.
Okay.
Thank you for sharing your time with us today. I hope you've gained insights to elevate your health and life. For more transformative evidence-based wisdom, I invite you to explore my 20-plus books at authorscott.com/shop. Don't miss out on the chance to supercharge your health and guide others to a better life. Like, share, and subscribe to join the movement transforming lives. Here's to your journey toward boundless health and happiness.